The moment somebody gets a seizure, Kenyans tend to run away from them. And in relation to the counties, have you worked with the health promoters or a policy so that health promoters could also teach common Kenyans how to give first aid in case of a seizure? And probably you could use this forum to educate the Senate and Kenyans on what should happen should you get a seizure. If you see somebody fall down, what is the immediate thing you should do to save that life? Thank you, Mr. Speaker.
Madam CS.
Thank you very much, Honorable Speaker, honorable members. Yes, indeed, seizures is one of the areas that is facing a lot of challenges for patients with the discrimination and alienation of the same. And so as a ministry, we are really working towards ensuring that patients receive, fast management. Part of it being through advocacy. We are also leveraging on our community health programs to ensure that we have guidelines and curriculums that are easy for them to utilize. Again, for the school health programs to ensure that these epilepsy and seizures are equally able to be managed before they are referred to the facility. So we are having policies. Yes, we have policies. We have guidelines. We are leveraging on community health promoters. We are educating our healthcare workers on the same so that we improve the management and reduce discrimination of the same. Thank you.
Senator Waheti Duati, Veronica.
Honorable Speaker, my question would fall under, my supplementary question would fall under question 10 by Senator Enoch Wambua.
Okay.
So I'll not push it now. I'll wait for the that moment.
Next, Senator Kina Ledama.
Thank you, Mr. Speaker. Mr. Speaker, my question is directly related to the responses given by the Cabinet Secretary from the question asked by Senator Muma. Now, Cabinet Secretary, you've indicated that the biggest challenge is the debt owed by county governments, about 6.2 billion to KEMSA. You've also indicated that SHA, which you know very well, that in the financial year 2024-2025 was allocated a total of 25 billion 798 827 666 shillings, which is up from the initial of 11 billion 899 413 839, which means there was an additional 13 billion allocated to SHA to be able to ensure that they provide this medicine to the people. If we are having problem, and I really would like you to pay attention to my question, if we have problems with drugs being administered in hospitals because county governments are not collecting the drugs, because they have not paid the money to KEMSA, don't you think that it is time as a ministry to develop a system where manufacturers, because the question you ask is about manufacturers, where drug manufacturers only release the drugs upon payment by SHA, so that these patients, and I speak this because when I was young, I was diagnosed with petit mal epilepsy. So I know the dangers of people who end up having epilepsy. So my question is, don't you think that it is time that you develop a robust system that can ensure that all those manufacturers list their drugs and only draw them down upon being paid, so that you don't have to incur all these debt? And I'll give you a very good example. It is like a supermarket. If you walk into a supermarket, you'll buy sugar. That supermarket does not own that sugar. That sugar has been placed there by a manufacturer. So the only time that it is released, it is when he's paid. We have SHA, 25 billion. And then you also have counties collecting money from ONSO's revenue to use. This House has passed a law. So can you please tell us how we solve that problem once and for all? It is not right for people who are sick, people who are epileptic, disabled people who are epileptic, to stay without drugs in their hospitals because county governments have not paid KEMSA for the drugs that they are collecting. Please answer that question diligently, and if you have not understood it, ask me again and I'll explain it. Thank you, Mr. Speaker.
Madam CS.
Thank you once again, Honorable Chair and Honorable Member. So indeed, drug availability is really critical for us. We have one of the key challenges that we have faced as a ministry is ensuring that the drugs reach the last mile and ensuring that we have accessibility to essential medicines. And under the UHC, that is the Taifa Care, we are really working tirelessly to ensure that, first of all, we have recapitalization of medicines in KEMSA, and again, that they are reaching the last mile, that is to the facilities up to level 2 and 3 for accessibility by patients. Now, what we have talked about and we are really ensuring that we implement is that SHA will pay, the counties will, SHA will, after the counties have requested, what will happen is SHA will pay directly for medicines before the money is released to counties. That is, when they receive the money from from the claims, part of the areas, apart from ensuring that they are paying the claims, they will ensure that medicines are also withdrawn from that money, and that way before the money is released to the county. So it is an area that we are looking into together with SHA to ensure that we are paying up for the medicines before the rest of the money is released. And that way we want to ensure that KEMSA is routinely recapitalized, it has resources, it has essential medicines to be able to supply at county level. I don't know if I've made sense.
Senator Ledama.
Mr. Speaker, I'm not sure the Cabinet Secretary understood my question. Because now you are saying that SHA will pay KEMSA before KEMSA releases the drugs to the hospitals. The question is, and I want to be clear, and I'm happy to come and sit down with you and try to explain better what I mean. The question is, since we are having a problem with counties paying KEMSA for the drugs, don't you think that it's about time to become a bit creative and develop a system that will ensure that these manufacturers place their drugs there, only release them when they are being prescribed to a patient? That will solve two problems. Problem number one, pending bills. Problem number two, expiry of drugs, such that they don't have to be, they will only spend drugs which can be used. Because every day we are told what manufacturers are doing, including others making drugs to confuse people. That is my question, because what you are now saying is that you will develop a system where SHA is paid money before KEMSA releases them. That's a bit confusing.
If you sit down, because you are not exchanging with the Honorable Senator, when seated you can benefit from your officers.
Yes.
You can benefit from them.
So, Mr. Speaker, I think I've made it very clear. But now I'll allow my colleagues to maybe piggyback on my question.
Your colleagues, it isn't any senator with a supplementary question. You can't give your colleagues that opportunity to do that. But I think she has now understood your issue. No, let her first answer. I want her to convince first Senator Ledama, then you can ask your. And I give you also an opportunity, remember? You ask your supplementary question. Okay. I'll come to your rescue at some point. And Honorable Senators, sometimes the CS cannot answer all the questions often. And I think you give a good proposal that you'll be going back with your team to consult and bring a report on KEMSA reforms. That is part of the reforms that KEMSA should be doing and yourselves, of course. But I know she's here to answer, but you know, as a chair, I should also be able to guide the House. Yes. That is why we have a chair, to guide.
Thank you very much, and we really we appreciate the innovative ideas that you are coming up with, and as I said, we want to work in collaboration and in partnership with the Senate to ensure that we are having medicines at KEMSA and also right down to facility level. So we acknowledge this, and we take your concerns seriously and look towards engaging. We'll be having a comprehensive discussion and a report on the health products and technology to ensure that they are reaching the last mile. So again, as I had said, once the county has launched a claim from a patient, what will happen is that SHA will pay to KEMSA directly with regards to the medications. Yeah? For each claim, SHA will pay directly to KEMSA. That way the resources will be there, and that way the medications will be there, and the cycle continues. However, we acknowledge that there are other innovative interventions that we can ensure, and we appreciate, Senator, for the interventions that you have placed in front of us. So we will have maybe engagements on the side to see how we can extensively improve the commodities reaching the last mile. And additionally, we will have a comprehensive report on how we are having our health products to be there at county level, and especially at our facilities.
So, Honorable Senators, on this issue, I want to guide that on KEMSA issues, I hope you are still the chair for health, isn't it? Or there is some guidance I wanted to give through the committee of this House on health.